2019.
Let's give a huge round of applause for that. The chair's prerogative, I just personally want to congratulate Bill and thank him for all the things that he has done and he continues to do for our community. In San Francisco, we really pride ourselves on patient care and advocacy, and I can't think of a person who better really exemplifies that. Also, I just wanted to share with you, and Steve will talk about this, I worked at UCSD for over 10 years of my career at the equivalent of Ward 86, which is called the Owen Clinic. So probably every day I said Bill Owen's name while I was working. And also you heard a little bit about this, the head of the Owen Clinic, Dr. Chris Matthews, who was a hero, a dear friend of mine, really was planning on coming to this event, and I vividly remember the story when I asked him, how did the Owen Clinic in San Diego get its name? So I'm not going to say that, I'm going to now turn it over to Steve for the rest of the program.
All right, thank you. This is quite an honor. Truly an honor to be part of this presentation for Bill. I met Bill back in 1993 when I first started HIV care, and that was sort of, I think, the depths of the epidemic. And Bill looked like he looks just now. Hasn't changed, hasn't aged, and had that. He always had that same smile that he has now, that he has in his picture. Even then, he was a very calming influence. Very famous doctor, one of the most famous private physicians in the business, and sort of the doctor's doctor. A lot of physicians wanted to go and see him, patients wanted to go and see him, and clearly he was a legend at that time. And I just got to know him over the 90s, and sort of after that, mainly through the research stuff that we were doing together. He was very supportive of the studies, and he would refer his patients. He was highly engaged, and we always had these great discussions about where things were going. But I always got the sense then that there was a part of the story that I didn't know about, but it happened before 1993. I heard rumors about it. But we have a slide about that. And so I just want to go through this. It's just focusing on the key period in the late 1970s. Bill had done his, he's from Philadelphia, I think. He had done his training in Massachusetts in the 1970s, was an ER physician, I guess, or ER trained doc here at UCSF, and then started as a private practice back in 1979 when things started to rev up. He was one of the smartest, most compassionate physicians I've ever met. He actually ran, he was a clinician here back for the 1990s, ran the clinic at Kaiser, and now is retired in Palm Springs. And he basically sent me and said the first meeting he attended of the Bay Area Physicians for Human Rights was in 1977, and that the feeling then was one of paranoia, that people only wanted to use their first name because of all the stigma, all the issues around being a gay physician during that time. But Bill basically brought everyone together, and that organization has focused on the special healthcare needs of gay and lesbians, and has actually now grown and continues to persist locally, meets monthly, but it also sort of became the origin for the Gay and Lesbian Medical Association, which is very active and very influential on a national level. And so Bill basically started that organization and has run it since then, and clearly during the early 1980s was very much involved in treating HIV, identifying it, educating the public, and so forth. And to this day continues to be highly engaged with this issue. And it's clear then that he was not an HIV physician, but really focused on the health of gay men in general. And linking both uninfected and infected was something that he did that I didn't really quite understand because we're an HIV clinic. But clearly today, when we're trying to merge the prevention needs and healthcare needs of particularly gay men, he was ahead of his time. Other things that Steve said that he found worth noting was that he was always very intensely interested in the latest technology. He remembers very clearly Bill walking around the Castro district with this very large mobile phone. This picture, and to this day, he basically told all his patients then to call him 24/7 for any of his needs. Steve said that I would say without prejudice that one of Bill's continued outstanding contribution to the practice of medicine, whether for gay men or HIV-infected individuals, was an ongoing belief that things were going to get better. And that was my sense. That's exactly what my sense from knowing Bill back in 1993. He had that sense that things were going to get better. Donald Abrams, who really desperately wanted to be here, but has a meeting at UCSF at 9 a.m. and couldn't make it, wanted me to say that Bill Owen is a doctor's doctor, one of the last of the great private physicians, and a chance to see Bill back in that time was a big ticket item in the early days. You know, like many gay physicians in that time, he never suspected what he would be getting involved with, but he was truly outstanding and comforted all those he cared for back in the time, and that he was a bitch. Anyway, Bill, so we have a plaque for you, and I don't know where it is. Here it is. And again, this is just a very special treat for me, and congratulations.
Woo! Yay! Woo!
Thank you all very much for coming to this. And I wanted to give special thanks to my family who's here, who's very, very supportive over the years, especially those tough years. My best friend, Stan, we've been friends since high school, 9th grade,
Yay.
Central High, Philadelphia. And he's a psychiatrist here in San Francisco. My sister is here, is an MD also out here. And also to, very importantly, my staff, Carl Stein is here. Carl is my first and only physician assistant, joined me on Halloween Day in 1994 and stayed with me till I retired in 2017, still works in the same office. And Carl saw the whole epidemic too, from the very difficult days. We had lots of people in the hospital over at Davies Medical Center until today, when we really can truly say that people with HIV can live normal lifespans now with the treatments we have. I also wanted to thank our other colleagues in private practice. I see. Oh, great. Get the picture. Oh, cool. Yeah. I see a number of them here, including Toby Diner. I saw Bob Owen, who's here. We're not related, but everyone thinks we are. And Bob was a gastroenterologist at the VA, who actually did some of the pioneering work on gay men's health in the 70s that I quoted in that review article that I wrote in the Annals of Internal Medicine. So that's wonderful. And Ken Mills, too, one of the early pioneers in practice I see back there. And if there's anyone else back there from the early years who I'm missing, please forgive me or raise your hand. Also, wanted to thank, in addition to Carl, the rest of my staff was so wonderful over the years. The woman in the center, Eliana Hernandez, who retired about two, 3 years ago now, and moved with her husband, who's to the right, to her left.
Julia, move about 2 feet. No,
okay.
No, move over a little bit. This, oh, right there. No. No, get
Yep.
your face right in the light.
I know, Uncle Bill.
Want me to do a dance?
Wait.
That was pretty good.
Stop.
That's perfect.
You got it. Woo!
Anyway, Eliana always wore red, but she was with me from before the official start of the AIDS epidemic in January of 1981 till just 2-3 years ago. So over a third of a century, and without her, it would have been so difficult to maintain a private practice. In addition to that, we had other greatest medical assistants too, like Gary Rust, who I see here today. And Gary's one of 6 of my medical assistants who were inspired by our practice enough to go on to become MDs. And he's a physician here in San Francisco and does ENT over at Davies. So in any event, I think that the most important thing, though, is thanking our patients, because Without them, the courage that they displayed, particularly during those difficult years of the epidemic, it would have been so difficult to continue. And thankfully, you know, we did have, as Steve mentioned, the hope that someday something would happen, something would come along. Many of our patients were activists. Somebody mentioned here, it was Monica who mentioned the Ambassador Hotel. And one of our patients actually was the manager of that whole institution and went on to become one of the biggest AIDS activists in San Francisco, Hank Wilson, and who unfortunately passed away a few years ago. But with patients like that, they were able to prod both government and industry to move on this and to come to develop new treatments that eventually resulted in the situation we have today, which is certainly much better. So I hope I didn't forget anybody there, but also thanks to you guys from SFGH and Board 86 here, because you've always been an inspiration, and certainly your San Francisco model has brought attention to our city's response to the epidemic. So again, thank you all very much.